on 4th. Avante Skin Center of Louisville, it's spring. You want to look better. They've got some spring specials. We're going to talk to Jamie and Ashley about those. And with me now is Dr. Anthony Dragun. And Dr. Dragun is with the James Graham Brown Cancer Center. He is also very familiar with the CyberKnife. It's relatively new technology, and all of that is under the umbrella of Kentucky One Health. Dr. Dragun, welcome to the show again.
Thank you, John.
All right, you're going to help me out here, aren't you?
Yep,
here we
absolutely.
go. I'm going to try my best here to pronounce this correctly. Trigeminal neuralgia.
Very good. You did a good job. Trigeminal neuralgia is it's a disease of the trigeminal nerve, which is one of the nerves that exits the brain in the base of the skull and provides sensation to the face, the forehead, the top of the face, and the jaw. The trigeminal nerve can be affected by this disease that causes extraordinary amounts of pain, discomfort, burning, stabbing-like pain at even the most inconvenient and unpredictable times.
Wow, you know, I was noticing in my notes here, they said it's been known as the suicide disease. So this pain is so excruciating that patients consider suicide.
Now this condition was first described in the late 1800s and early 1900s by a physician by the name of Harvey Cushing in the United States, who in his first 100 or 150 patients that he described with this disease, about 1% of them it was so bad that they committed suicide. So it is, and it's just as bad of a disease today. It's great that we have more effective treatments for it.
Dr. Dragun, before we get into those treatments real quickly, is this something that's genetic? It is something that's just random? How can someone really kind of get in front of this and prevent something like this?
Yeah, it's not something, unfortunately, that prevention deals with. It's something that happens quite randomly and sporadic throughout the population. It's something that is more common than people may realize. About 150,000 patients in the United States every year are affected by trigeminal neuralgia. And the problem with it is that people may go through many different steps of misdiagnosis before the diagnosis is actually made. So they may think that they have a tooth problem, and they may go through a root canal or have their tooth extracted or have some sort of jaw surgery thinking that it's going to relieve the pain in this area of their face, and nothing works. And so typically when we see these patients, they've been to 5 or 6 doctors and maybe dentists along the way before the diagnosis is finally made.
If this all sounds like dreadful news, we do have good news for you. There is a new treatment. The CyberKnife has stepped in. First, I guess we should preface this with what were traditional treatments, and then how does the CyberKnife different, and how is it more beneficial for patients?
Yeah, so when the therapy was first described, when the disease was first described back over a century ago, it was something that was they attempted to treat it surgically. Surgery was not very effective and often involved a lot of side effects such as paralysis of part of the face and functional swallowing difficulties and things like that. So there have been some medications that have been developed over time, and we generally recommend people to try medical therapy first. Trigeminal neuralgia is responsive to some of the new medicines that are on the market. Some older medicines work as well, but generally you give a trial of medications to try to reduce the episodes of the stabbing pain.
Wow. Now CyberKnives, how can they be used? If you're not familiar with those, Doc, if you would kind of familiarize a little bit with people. From what I understand, for someone like yourself, Doctor, you being someone who deals a lot with cancers, correct?
Yes. Yeah.
So it can really kind of pinpoint the cancer and more directly treat, correct?
Yeah, so the interesting thing with trigeminal neuralgia is it's one of the few non-cancerous conditions that we treat. There's a handful of non-cancerous conditions that radiation therapy is very, very effective in treating. And so what we typically see is a patient in whom has tried medication and it's not enough. Or it's tried medication and it hasn't worked at all, and they're referred to us, and we can target a beam of radiation right to the nerve and kill those aberrant nerve fibers that are firing off those pain sensations to the patient.
You can see there the video, and I might have you do a little bit of the play-by-play there, Doctor, but as a radiation oncologist, I would guess this is I know now it's not new to you, but since it is to patients, this is great news.
This is the best thing about this piece of technology is that it's completely non-invasive. There is not people, the word knife is in the name, but it's really that the beam of radiation, the beam of X-rays is so precise. It's like using a scalpel blade with its accuracy. So there's a piece of technology, an older piece of technology called the gamma knife, which was it's been around for a number of decades and is still in use in the United States in a lot of places, and that can treat trigeminal neuralgia too. The problem with the gamma knife, the older piece of technology, is you had to have a frame bolted to the person's head in order to immobilize the person for the treatment. The CyberKnife, the person's completely immobilized, their head is maintained still by a total non-invasive head frame, and the machine does its work, rotates around the body, rotates around the head, delivers the radiation precisely in the trigeminal nerve, and completely spares the normal brain tissue.
Wow. Now, you talk about the benefits with trigeminal neuralgia. I would think the CyberKnife would be great with other cancers as well. Why not every case of cancer we get, why not use that if it can pinpoint?
Yeah, I mean, it's becoming, the indications are becoming more and more. To stick with the benign diseases in the brain, we see more and more patients with what are called arteriovenous malformations, or AVMs. These are blood vessels that are in the brain that can trigger seizures, and the CyberKnife and this technology is very useful for doing that and making those go away. But treating brain tumors, treating spine tumors, prostate cancer, lung cancer, pancreatic cancers, liver tumors, and we're even investigating its use in breast cancer. The indications seem to be growing all the time because it's such a great piece of technology.
Wow. Now, James Graham Brown Cancer Center, I would assume you guys have always been very innovative and on top of cutting-edge research. Is there more of the CyberKnife available? Why, I guess my question is, why go to James Graham Brown Cancer Center if you have trigeminal neuralgia?
Sure. I mean, I think that it's important for people to ask questions, whether they have a condition like trigeminal neuralgia. I think we're raising the level of awareness. If there's someone out there who's watching and has facial pain that's not been treated adequately, and they can see this and hopefully are a family member and get to a neurologist for a diagnosis. But you want to ask questions about alternatives. If you have prostate cancer and you see a doctor and he tells you, I've got to take your prostate out, or you've got to have 50 treatments of daily radiation, you need to ask more questions. And what technology is there out there? I mean, the Internet's a great resource nowadays. People can get a lot of information about our center on Louisville CyberKnife.com. So.
With the CyberKnife, doctor, the feedback you're getting from clients, do you see a drastic difference from years past when you had to do the standard, types of chemotherapy? Now you see a CyberKnife. Do you see people who are a lot more active, who aren't not as many side effects?
People can't believe, I was telling this patient the other day that we were going to treat her lung cancer, and she was really worried because she was on oxygen because she had this early lung cancer, but she also had emphysema, and she was really worried that she would go through this treatment and she would not be able to handle her breathing, her shortness of breath would get worse and everything like that. And when I kept telling her that she was going to get this treatment, it was going to be pinpointed to the tumor, and there was going to be absolutely no side effects, it was hard for her and her family to believe. But that's the way it is, and it's becoming more and more common now where we develop these therapies where they have very few or no side effects and are highly, highly effective. So the CyberKnife is part of that story. It's the biggest part of that story in my field in radiation, and the Brown Cancer Center is the only place in the region where you can have access to it.
I love that. Another point of pride. We talk about, what are considered, when you talk about cancers, trivial things like thunder over Louisville, and then when you talk about serious matters, another point of pride here with, of course, the James Graham Brown Cancer Center. All right, doctor, I love that news about the CyberKnife. So if something happens to me or one of my family members, my producer, or someone here at Wave, we just go straight to you, right?
Yeah, I suppose my phone number's not listed directly, but you can get in touch with me if you try hard.
I love it. It seems like it's all good news with the CyberKnife. Before I let you go, I always like asking this question. Do you see anything on the horizon as a doctor that excites you about cancer treatment?
Yeah, I mean, I think that in cancer treatment in general, we're becoming more and more tailored, and there is more and more genetic information that we're getting every day about how to directly tailor our therapy to that person's specific cancer. Not just their cancer type, but the type of breast cancer or the type of prostate cancer that they have.
Interesting. That is good news. Dr. Dragun, thank you very much.
Always good to be here.
Love it. James Graham Brown Cancer Center, Kentucky 1. One Health. Dr. Anthony Dragun talking about the CyberKnife. All right. Keeneland,